Hi, everybody. It's Karen Anderson here with Aortic Hope's live Q&A event. This is a special one. It's a first time for us. Yes, I'm sick because I went out of town. You know that this happens. This is what happens. So don't mind me and my coughing and my voice, but you're not going to have to listen to me much tonight, which is great, right? Before we get started, I need you to please press like. Please push subscribe so that you'll get notified every time we go live and you won't miss any kind of event like this or weekend reviews or survivor stories, etc. So tonight, there's so many people that are in the middle of the disability process. And when you go through the disability process, when you are finally approved, fingers crossed you get approved, that triggers that you can begin receiving Medicare benefits, even if you're 35 years old, 40 years old. There are some people who already are on Medicare, but open enrollment, it's just so confusing sometimes. And actually, the people at Medicare are so nice. They're so nice to call and contact. Then there's also people who are getting of age, but they also have these issues. Not that that means anything, but what does it mean for those of you who are about to switch and become the special age to receive Medicare? So this person that's joining us tonight is your specialist and is going to help educate you on everything that you could need to know about Medicare. So this is our 101, and I'm so excited to have this because I always have a million and one questions myself. So I'm going to let you take it away. Welcome, Rosie Paulsen.
Hello, buenas noches, everybody. Good evening. Thank you so much for the opportunity to talk to you guys. And this is my first national interview, so I'm super excited. So just
national, girl, this is international. What are you talking about? We could have people watching from all over the world. Don't be nervous. It's just you and me. It's okay.
International. Well, awesome. Really, I appreciate it. I appreciate this opportunity. So I'm a business strategist, and my background is in the Medicare arena. So I actually help other insurance agents that they want to build a service-based agency and take it to the next level. So my company, because of my husband Scott, which many of you guys know, is called S&R Services. S for Scott, R for Rosie. I've been in the Medicare arena since I was up for about 20 years. I say to people that I was 12 years old when I started. and the child labor laws did not apply back then. But when I started, there was really no one doing Medicare. The under 65 market was very profitable, so people did not want to touch Medicare, not even with a 10-foot pole. But I stumbled into that. The first thing I did is read the Medicare and You book, which I think I have it somewhere in here. We just got a Medicare and You book. But I read it from cover to cover and realized it was so confusing. And me at 33 years old thinking, oh my God, how am I going to have to explain this to an 80-year-old, perhaps a 90-year-old?
That book is in the pile with wood waiting to be burned in the fall, because I looked at it and once I saw it was this thick, I was like, I cannot read that.
Then you get all the carriers mail and postcards and emails and now they're calling and they even coming and knocking on your door.
Yeah.
So it's like it has changed tremendously. But and I hate to see be the bearer of bad news, but this 2025, because we have the Inflation Reduction Act, it changed the game completely. So this year is going to be a very disruptive year in our industry. So usually with seniors and especially people that nobody wants to talk about insurance. Let's face it, you just want to make sure that when you get sick, the insurance works and you don't get stuck with a whole bunch of bills. So my job is really easy because I say, give me something. I don't care what it is, as long as it works when I need it. And then don't ever talk to me about it unless I get sick. Okay. But the reality is that at least my job is to make sure that I'm in your corner watching for your best interest. So for the past, I would say 10 years since all the changes had happened, I have not had to change. But this year I have to review most of my clients' policies because of the disruption on changes. So the presentation I'm going to go with to with right now. It's a little bit, it has a little bit too many slides. So some of the slides I'm just going to pass through them, but I am going to do, okay, here we go. So Medicare 101, that's my contact information. The QR code that goes to our website is in our services. And by the way, if you're also looking for a source of income, being a Medicare agent, actually helping people with insurance, it's the most amazing, rewarding career there is. We are raising the next generation of insurance leaders with a servant heart that is here to change our community. So I tell people, I cannot teach you how to be ethical. I cannot teach you how to have a good heart and empathy, but I can certainly help you help others with their health insurance options. Okay, so there's my contact information. And let's start with a little bit about me. So I've been in this industry, like I said, for about 20 years. My husband Scott and I lived in Zephyr Hills, Florida. We've been married for about 18 years. We got 3 children, 3 adult children, no grandchildren yet. And then we have 2 fur babies, Sandy and Sabrina. And literally, Sabrina is my baby, which Scott jokingly says that I kidnapped from the park because she followed me around. And she's just like my cute little baby. She has a personality like me, and she's just a little crazy. But
what kind of dogs? You have to tell us now. What kind?
No, they're not dogs, they're cats.
Oh, cats. What kind of cats?
So Sandy Claus, which is Scott's cat, she's a short hair kitty. And then Sabrina, which, hold on, I'll show you because I have to show her.
I live for this. I live for the disruption of a cat.
She's very talkative. This is Sabrina.
Oh, very sweet.
This is the one hold on, right there.
There she is.
The one I found in the park, and Scott says that I drag her to her home. But this little one followed me 4 miles. So I tell people she had tenacity because she wanted to be mine. So she followed me for 4 miles. So awesome. So my license also is in the state of Florida, but the company that I have my insurance contracts under, they're national. I do have a non-residence license in Illinois and Texas, so I can help people in those states. But my agency, which is right now, we have about 13 agents. We cover all over the United States because one of our agents have a license for one of the states.
Mm-hmm.
And then who we can help. So people turning 65, those are the ones that are more confusing. So you start thinking about Medicare at age 64, all right? But now, because everybody's targeting so much, we actually starting a little bit earlier at age 63, because what we want to do is build this relationship and this rapport. But anybody that is over 65 years old and is losing insurance for so many reasons, they're retiring, their spouse is retiring, and they're getting out of the state and their insurance is not covering them in the new state, we can help. Whether that you maybe went part-time and right now you want to retire, but you don't know because you're keeping the insurance just because you think you cannot get a better insurance than what you have. Those are people that are good candidates for us. Insurance or enrolling Medicare and unhappy with the current coverage or Social Security disability. I think the biggest thing right now is people, like I mentioned, they don't want to talk about insurance. Insurance is something that you need, but you don't want to talk about it. You don't want to know too much about it. So that's where it has given me the opportunity to help others. And give me 1 second. I'm sorry. You see my husband's leg?
In the camera. That's fine.
So I know one of the things is people says, I want the A, B, C, D, F, and the soup, and the alphabet soup of all these things. And we're going to go through that. And I'm going to make it very simple. I said, I simplified Medicare after 20 years. Both of my parents were teachers, and I remember the easiest way to learn is keep it simple, right?
Yep.
So first of all, what is Medicare? It's the government's largest health insurance program, serving more than 62 million Americans, and it's a federal health insurance. It's for U.S. citizens and legal residents, and it's individual. So your wife cannot be under your Medicare, or your spouse cannot be, your husband cannot be under your wife's. It's individual, and you get this by applying, by paying the FICA taxes from our employers. So at age 65, when you, even if you don't want to retire, at age 65, you get Part A of Medicare because you have contributed on your FICA taxes. What Medicare is not is Medicaid, because Medicaid is actually the states, and each state have a different name for that. But Medicaid is the assistance locally from the states based on your income. It is not Social Security. However, the biggest confusion is for you to apply for Medicare, you have to go through Social Security. So here's the thing that people say, but I don't want to collect Social Security. And I said, no, you don't have to collect Social Security, but you have to go through Social Security to apply. So they just apply, you use Social Security to apply for Medicare, but you don't have to be collecting Social Security to get your Medicare. Some people delay their Social Security until age 67, sometimes a little bit more, but it is not mandatory for you to have Social Security and collect Social Security and have Medicare. But you, at age 65, you already get it because you already paid into the system. And the other thing that I wanted to tell you is that this is not given to you. This is not something that you know, is complimentary. No, you have contributed to this fund for the healthcare all your life. So it's not an entitlement. You pay for it. You pay for it. So always remember that empowerment. This is money that you have paid for. And they're not family plans, right? They're individual health plans. Who can get Medicare? You can qualify for Medicare within the first 3 months turning 65 or older. So 3 months prior, your month of birth of 65, and then 3 months after. So for example, if your birthday is in February, so you start January, December, and November, you can go into Medicare, socialsecurity.gov and apply, or you can call the 800 Social Security number to apply for Medicare 3 months prior to your starting date. Now, if you are collecting Social Security because of disability, usually they send you a Medicare card right away 3 months prior. But if it doesn't happen, you need to call. People younger than 65 with a qualified disability. So for example, end-stage renal disease, that is one that will automatically give you Medicare. Okay. Sometimes the disability, you have to be disabled for 24 months, and on your 25th month, you receive Medicare. Now, disability, if the disability changes, then what happens is that you can lose that disability Medicare, and then you have another enrollment period when you turn 65. And then have end-stage renal disease, and then it's now called kidney failure. Actually, they rebrand the name, and it's end-stage kidney failure, because a lot of people do not understand that renal has to do with your kidneys. So, and the summit that Scott was talking to you about, we just had to celebrate aortic hope. Aortic
disease.
No, it was not disease. Is the
dissection?
What you had, baby? Aortic Dissection Awareness Day was September 19th.
Yes.
So we had the first summit condition, the chronic condition summit, and we had 3 people talking about, one about diabetes, Scott with the heart issue, and then another lady that was going through kidney disease, and she's waiting for a transplant. So it was very fun, and it was so successful that now they want me to do it all over the United States and more often. So it's going to be kind of one of those people that I will be able to put in these things together and tell you more about chronic conditions and what qualifies for this special election periods. So
wonderful.
Original Medicare covers Part A and B. Part A is the hospital insurance and Part B is the doctor's insurance. Now, people says, okay, I get Part A, that's the 65. As soon as you turn 65, you get Part A of Medicare, and you can see there what that covers. Part B does have a cost because when people started in the Medicare arena, there were 10 people contributing to Medicare and one person withdrawing. But with the baby boomers now, it's 10 people withdrawing and one person contributing. It's not,
right.
it's not being enough. So they had to have a premium on the Part B. And right now, as of 2024, it's $174.40. And that comes out of the Social Security if you're collecting, or you get a 3-month 3-month bill. So every quarter you get for the 3 months a bill for this premium for the Part B.
Now that premium, if I'm correct, that's based on household income, correct?
Yes, and it's gonna come in here really quick. So I guess I jump a little bit, but here's the $174.70. The deductible, so Part A does have a deductible of $1,632. So when you go to the hospital, the first thing that you'll get is the deductible bill to you. And then 20% of every doctor that saw you or saw your chart would charge you 20%. And then there's other costs that $408 if you stay more than 60 days. Now in the Part B, there is the premium of $174.70. See, Part A, you already have your premium paid because you already paid it with the FICA taxes. There is a deductible of $240 for the Part B. So if you go to the doctor the first time of the year, like at the very beginning, to just check up with your doctor, the first bill you will get is $240. And then 20% of that visit. All righty. So this is a little bit more detailed cost, but you were asking about how much people pay if you make more money than what they consider the amount, the threshold, right? So this is, if you guys want to know, there's some prices here, but $103,000 a year or less, they pay $174.70. But as you increase your income, then you pay additionally this amount. Okay. All righty. I'm gonna go to the
now
next
again
one.
You were saying that once you hit 65 you automatically get A with those costs that you showed associated, no premium, just the deductible and the various costs based upon how many days you might be in a hospital,
right?
But so for those of us that end up on disability before age 65, we are given Part A and we're also given Part B because we might be 40 years old, but we're given that opportunity to do both. Okay.
Yes, exactly. And it's because of your disability. And this is something that I learned with all my experience, but and this is the first time when I learned about disability. So I go to my first appointment and there's this young girl. She's about 24 years old. So I swear that talking to her, we were talking about her mom. And she asked me, Rosie, does Medicare cover pregnancy? And I'm so 65 years old. Where will you think that somebody will cover pregnancy? But I didn't want to say no. I said, well, this is a good question. Let me ask. So, and I said, but why do you ask? Why would you want to get pregnant?
Right.
Again, not knowing. And she goes, no, it's for me. And then I said, I realized that she was actually a Air Force pilot. And she had PTSD, and because of that PTSD, she received Medicare. So that's why she had called me, and she was about to get married next year, and she was thinking about starting a family. So to answer the question, Medicare does cover pregnancy because it's considered a temporary illness of the person that has a pregnancy. So if you are under Medicare for disability and you get pregnant, Medicare will pay for that. So that was, those things that it was very nice to learn and understand. Now, what does original Medicare does not cover. They do not cover all the cost of all your care. You will be responsible. They pay 80% and you will be responsible of 20% after your deductible. Okay. So, and there's no maximum out of pocket in Medicare. So that's where the Medicare, having a straight Medicare, can be a little bit sticky. Okay. They don't cover prescription drug coverage. They don't cover annual physicals, dental, vision, hearing aid, eyeglasses, long-term care, or anybody that resides outside the United States. And you're probably saying, but Rosie, I've seen TV that they cover all this stuff. Well, there is more coverage that you get, and this is how we're going to go through it. So you have, once you have Medicare, you have two options, okay? The set and forget, which is original Medicare, a supplemental or Medigap plan, and a prescription drug coverage. So when you go to the doctor, you will present your Medicare red, white, and blue card, your Medigap policy, which is the private insurance company that pays what Medicare doesn't pay. That's in the doctors and hospital. And then you have a third card when you go and pick up the prescriptions at the pharmacy. Okay. Now we're talking about $174 for the Part B. Depending on your age, the Medigap, depending also on the area, can start $74 to $164 if you're new into Medicare. Then depending on your age, it can be more. And some Part D plans right now have a zero premium. But when you add up, it does adds up to about $300, $350, depending on the state that you're located, right?
Right.
That's your first option. Option number two is pay as you go. And that is where the famous Medicare Advantage of Part C of Medicare are here to help. Those usually have the prescription drugs included. And they are private insurance companies that have the contract with Medicare. So instead of having three cards, you present one card when you go to the doctor, when you go to the hospital, and when you go to the prescription or the pharmacy. Now, they are regulated by Medicare. So by law, you can't get anything less than Medicare. But what changes is the network and the co-payments. But eliminate, some of them eliminate the co-insurance and eliminate the deductible. Plus, they have a maximum out of pocket. So for whatever reason, if for any, sometimes people that they have dialysis, for example, they're responsible for 20% of the dialysis up to the maximum out of pocket. Okay. All right. Next, Medicare supplemental. You pay a monthly fee in addition to your Part B. There are about 10 plans, and when you have a supplemental, is the same because Medicare would pay first and this plan would pay secondary. There are many insurance companies that they have they offer Medicare, but again, they don't have any drug coverage, no dental, no hearing, no vision benefits. They might have some discounts, but none of that. And no medical underwriting up to 6 months after enrolling to Part B at age 65 or older. Now, for people with disability, a Medicare supplemental, we're talking about over $700 a month. Because of the disability, because if you get Medicare through disability, is because something major is happening and you're young. So that's why if it's through disability, I've seen premiums of about $700 that they start. So that's where people might not be able to afford that, and they go with the Part C or the Medicare Advantage. Now it's guaranteed renewable. So if you started at age 65, you get that premium, and it's guaranteed. Now there might be some increases every other year, depending on the utilization rate. But again, as long as you continue to pay, you will pay the original amount, and it's always going to be less when you start with Medicare. Okay. And the coverage is nationwide because Medicare will pay first, and the supplemental will pay second. And nationwide, they would pay a little bit, like 100 miles north to Canada and 100 miles south to Mexico. But
Okay.
really, Medicare doesn't pay international travel, or going to a cruise and you get sick. That will not be covered by Medicare.
Okay.
Okay. Um, the options of Medicare, this is where the alphabet soup goes, right? A,
Right.
B, C, D, G, K, L, M, and C. So just the only thing that I probably want you to think about this is that people that had Medicare before 2020, they can get that plan F, which is the plan that covers pretty much, if you see all the little check boxes, it covers everything that Medicare doesn't have. But anybody that became 65 or after in 2020, then the only available, the plans that they're available to them is the G and N plan. And G usually has the deductible, so the $240 Part B deductible. After that, everything gets paid for it. And the G also covers the 15% that some specialists are allowed to bill because of their specialty. Okay. But the G and N, the N doesn't cover the 15% extra that they can cover. Okay. All right, and this is a little bit kind of like that. So I'm just going to go ahead and move on with this.
Let me ask you a quick question. So basically, when you get B, if I remember what that slide said, it covers 80% of your physician bills. You're left with 20. Now, when you get the supplement pays how much of that 20%? Because I think that
the whole 20%.
They're just going to cover the 20. So you really don't have, like, I never pay any copays when I go to doctors, and I don't pay, we really don't have any bills. I only get bills when I go to the hospital. But everything seems to always be taken care of. And I get bills when I go to the hospital, and I get bills with prescription. But doctor visits and stuff like that, it seems like it's always taking care of everything.
Right. So your deductible is first. So the first thing that you will pay is that $240 at the beginning of the year. Right. And then the 20% coinsurance. Now, some people say, well, the 20% coinsurance is $40 at the primary care physician. Okay, it's not bad. But if you start going to a lot of that might add up. And if it adds up more than $160, which is what the Medicare supplemental costs every month, you must well go with a Medicare supplemental. Okay. Mm-hmm. Some of the Medicare, and we're going to talk about now the Part C. So most of these plans, like I mentioned, they have the same benefits as original Medicare. So you will never be able to have something less because you're going to a Medicare Advantage plan. Another thing that everybody says is Medicare Advantage are going to go away. No, they're not going to go away, because there's about, I don't know, in Florida, 68% of Floridians in the age of Medicare have a Medicare Advantage. So you cannot leave out 68% of a population without coverage, okay? They do, most of the plans include the prescription drug coverage, so you don't have to have an additional policy. They cover routine dental, routine eye exam and eyeglasses, hearing tests, hearing aids, wellness programs, okay? And then most of the plans have a zero premium. Now, that doesn't mean that the plan is a cheapy plan and, it's a bad plan, because that's what I hear from everybody. I want the Cadillac of the plans. Okay, I don't know what the Cadillac of the plan is, but okay. But you pay zero, but Medicare pays the private insurance company between $1,000 to $1,200 every month for your care, regardless of you using the plan or not using the plan. Now, if you have a chronic condition, or if you have especially end-stage kidney disease, they even pay more than $1,200. So what happens is the private insurance companies keep an administrative fee, and then most of the stuff goes back to the care of the patient. Okay, there's typically a maximum out-of-pocket even for prescriptions and medical bills, and you have so maximum out-of-pocket. So like I mentioned, if you had to have dialysis or chemotherapy, you will pay up to the maximum out of pocket. So that kind of helps. And a lot of people says, okay, Rosie, if something catastrophic happened, how much do I have to keep in my bank? So depending on the maximum out of pocket of your plan, I'll say, okay, 1,900 or 5,500, depending on your plan. Other factors, some of these plans, you might need a referrals. The HMOs are the ones that they are very popular, and sometimes the ones that get it a little sticky. So we'll talk about more a little bit. And then the coordinated care support with the provider network, because you do have to stay within the network. Medicare being a fee for service, as long as the doctor accepts Medicare, then you can go see them. But in the Medicare Advantage, in order to keep the utilization rate manageable, because that's why they started, they have to have doctors that are able to manage that care. Now, about the Part D of prescription drug coverage, this started in 2006 by the Medicare Modernization Act. Is because a lot of our seniors were selecting between, should I eat today or buy my medication? A lot of people couldn't afford their medication, so this was created. Originally, it had 4 phases, like the deductible coinsurance, the famous donut hole, and the catastrophic. Now, after the Inflation Reduction Act that is going to be established next year, most of our Medicare recipients are only going to pay $2,000 a year on prescriptions. Now, you might think this is a great idea. The only thing is that people in Medicare that utilizes more than $2,000 a month is about 2% of the Medicare population. The other 98% that do not pay $2,000 with medication, what has happened is that their coverage now is either they have to pay a higher copay in certain copays, maximum out of pockets have increased, and some of their plans have exited their area. So for example, they just got a letter saying, hey, you know, your plan is no longer going to be available for 2024. If you don't select anything, you go back to original Medicare. But the benefit of this, and this is going to be good perhaps for people that they are in that disability, or somebody at age 65 that wants to go into a Medicare supplemental. If you receive that letter, there is guarantee issue. So you can have all kinds of illness. If you want to go to a Medicare supplemental, this is the time to do it when your plan is exiting the area, because it's guarantee issue. They don't ask you any of the qualifying question. Underwriting, there's no underwriting. So that's going to be one of, I think this year is going to be my year where we're going to be selling a lot of supplemental. And Florida has the high deductible G plan, which is very popular right now because the payment a month is about $74, depending on your age. But the maximum out of pocket is $2,800. After that, everything else is covered. Okay. So as long as you know, and some people pay $2,800 sometimes in 2 months with the premium that they pay for the private insurance company.
Right.
So, okay. Next thing here. This is a little bit of the details. Remember, if you earn more money, there's also some extra payments that you have to do for the Part D of Medicare. So this is the extra payments that you have to do. I'm going to leave that really quick, so maybe if somebody wants to take a picture. Okay. Then the coverage, like I mentioned, I went from the annual deductible, the initial coverage, and the catastrophic coverage, but this by 2025 is going to go bye-bye. And also there is a change that happened in 2025 where you can actually take this $2,000 payment and divide it by 12, okay? So you can make monthly payments. So for example, if your prescription was $500 and you in the monthly payment, you pay the $100 and something dollars, that will be $103, I think it is, and you pick up your $500 prescription. Or you would pick up $500 prescriptions the first 4 months, and then after that you pay $0. Okay.
What I
All
think
right.
is crazy about the drug situation, and I mean, and I'm in a good situation to be able to afford things, but still, when I see some of the costs of some of these medications, and you can't go and try to get a discount card. If
Mhm,
you have Medicare, they will not let you get good RX. I
mhm.
mean, you might be able to try to call the drug manufacturer, but even
Right.
still, they'll ask you, are you on private or are you on a government plan? And they a lot of times don't want to even give you a reduction, but this is the most vulnerable population that needs the help on the cost of the medication. Do you see any of that changing?
Well, this is where we call it, right, our the servant leaders for our team, because this is a calling for us. Sometimes it's doing those phone calls, and sometimes the blessing now that I have is I actually now have my own customer service department. So instead of you having to call your private insurance company, you call my customer service department, who has all your information, and they will actually apply for the manufacturer for you. They will
Oh,
tell you the options. I
okay.
also have, because of my local connections, the Canadian Med Store also is another option. So when I have people with a lot of utilization and issues with prescription drug coverage, and regardless the age, I send them over there. And the Canadian Med Store, what they do also is that if they have to, let's say that this medication is cheaper running it through the insurance, and then you get these other medications through the Canadian Med Store, they will tell you, and they will play around, and they will do everything. But it is, I think, one of the reasons why I became an advocate about this, because I know I'm serving the most vulnerable population,
Mm.
the one that everybody wants to take advantage of. And I always think about my parents, and I think about my grandparents, right? And I always say, I hope you know what I do when I serve people and when I go review their policies. Um, it's not about me, it's about them and them having the right coverage, right?
Right.
And most of I had a partner, and my agents went to had a previous partner that they purchased my company, and he said to them, welcome to the get rich slow way to get rich. And if you're consistent, he says, the first year, the second year are the hardest, because you people don't know who you are. But after that, it just goes. And the
Mhm.
more you want to help, this is just the best way to do it. All right, make it a decision. This is where I come in. I help you. So what do? We get your prescriptions. We get all your medications. I mean, not your medications. We get all your doctors. We get all your pharmacies. If you wanted to, if you visit your kids and you're 6 months in North Carolina and 6 months in Florida, all that information helps me to figure out which option of the two options is best for you. Now, the thing is that if we make a mistake, there's always a special election period that we can make a change. And if the worst case scenario happen, every year between October 15th to December 7th is the annual enrollment period, and you can go back to original Medicare and whatever you had before. You need to consider, what are you willing to pay on your premiums, right? Does the plan I'm considering have the benefits I'm looking for? How important it is for me to have vision, dental, hearing coverage. Some clients, they actually have that from group health, so that's not important to them. Am I okay with having a restricted list of providers? Some companies have a larger list of providers, some of them have a smaller one, but not everybody knows that. I know this because of my tenure on the industry. So because
Mhm.
I'm very blessed that everybody says, come on, Rosie, find this out. And I always ask questions, and I don't know why, but people share things with me that sometimes I'm like, okay, did I really needed to know that? But okay. Um, and do I feel comfortable using a plan that manage any chronic condition? Remember, heart, diabetes, COPD, and end stage kidney disease are the four chronic conditions that there are chronic plans that we need to look into. Now, cancer is a chronic condition. There's others that Medicare recognize as chronic, but they don't have chronic plans that you can select. But those four is the ones that we have chronic plans for. Addition, this is where the additional consideration comes, do you have diabetes, heart? Now, there is people, depending on the state, that may have an income that is below the threshold, okay? And they qualify for Medicaid also. So they have Medicare as a primary and Medicaid. Now, Medicaid no longer pays because they don't have like a Medicaid only. Medicaid is a managed care. So if you don't select a plan, Medicaid will select it for you. So I tell people the job is, let's get it together so we can get a Medicaid Advantage plan that has included your Medicaid in it, because that's the one that will give you the most savings. So I don't know if you guys seen the famous Flex card. Everybody wants that Visa card that you just go somewhere and pay. That's usually for people that qualify for Medicare and Medicaid, okay? But seniors love that Flex card. That's how they get people to answer the phone, but not everybody qualifies for that Flex card. If you live in a nursing home and facility, that's another of those things that we need to consider. So long-term care is not covered under Medicare. So long-term care should be a policy that you purchase at a young age when you're not sick, because once you get to once something happens, long-term care becomes very expensive. But people think that Medicare covers long-term care, and it doesn't. It covers a skilled nursing facility, which is temporary. It comes home health care, which is we're going to do this and we're going to get you better and out of here, but not for something that you have to stay long-term. Okay. Financial assistance is Medicaid. There is also the Medicare Savings Program, which it helps you pay with the Part B. Low-income subsidy, and I'm almost done with this, but low-income subsidy is something that is very important, and especially for you guys that if you guys have the disability, okay? People think Medicaid and low-income subsidy is the same thing. 75% of Americans qualify for some type of low-income subsidy, but they don't apply for it because they think it's related to Medicaid. And low-income subsidy, you apply it through Social Security, okay? So what I tell people is just apply. There's 4 levels. Even if they give you a 25%, you pay 25% and they pay 75, whatever, that gives you an open enrollment season for Medicare, but it helps you with your prescriptions because your prescriptions will go from $3 to about $12 or $13. So even if you have very expensive prescriptions, you qualify for low-income subsidy. You can get them for more affordable prices. Okay, and there's a lot of local additional programs. Enrolling in Medicare. When you're new to Medicare, it's the 3 months prior, the month of your 65th birthday, and 3 months after. Once this happens, then we come what is called the enrollment period for Medicare supplemental. So if you decide to go the route of Medicare supplemental, the first 6 months is guaranteed issue. So they will not ask any health questions. But after the 6 months, you will have to ask underwriting questions.
Now, does that apply to people who began their coverage prior to 65 due to disability?
No, so if the coverage is there and they already purchased it, that's not gonna, so if you turn 65, it actually gives you a new enrollment period for age of 65. So at that time, you might be able to purchase a supplemental with the rate of 65 now, if you had 65 before. Now, people also can come and purchase supplemental at age 65, try for a couple of years, and then they decide to go to a Medicare Advantage. They have 1 year to go back to the original, to the Medicare supplemental. No underwriting questions asked, but you will have to pay the new, if there's a new rate because of your age. Okay. People that they're working that they're still working after the age of 65. Some companies, if their employees are 20 or less, Medicare, they can delay without penalty. because it's considered creditable coverage. That's the other thing. You have to have creditable coverage for prescription drug coverage, because if you don't and you decide to get prescription drug coverage later, you will get penalized 1% for each month that you were not eligible, that you were eligible to apply for Medicare Part D and you didn't. So it comes out to about 68 cents per month. But when you add up 10 months, that adds up to some money. And this is for the life of your life. So it doesn't say, oh, after 10 years you stop paying. No, this is for ever. So I always tell people, just get the government off your back, get your Part D prescription drug coverage that is zero, and you don't pay that penalty.
Okay.
Enrolling into Medicare. The one thing I want to, and I'm just going to go to the annual enrollment period, which is what's happening right now. Okay, October 15 to December 7 is when you can change every year with an effective date of January 1st. Now, October 1st to October 14 is when you have the chance to review the new changes. Many of you have received your annual notice of changes now, or have received that letter stating that your plan is exiting the area. If you know somebody, just give us a call. We would love to help you and walk you through this. It's not the end of the world. Don't hyperventilate. We can get you through it. And whatever decision that will happen, it will happen as an effective date of January 1st. Now, if we choose the wrong plan, or you have buyer's remorse, of January 1st to March 31st, you can make one change, and it has to be plan to plan. So same plan to same plan. So if you have a MAPD, Medicare Advantage prescription drug coverage, you can go to another MAPD. If you have only a Medicare Advantage without prescriptions, you can only go to a prescription. Okay. And then there's the special election periods, especially in Florida with the hurricanes. Every time a hurricane hits over here, we get a special election period. So there's also the 5-star ratings. Those are the big ratings that the insurance companies get, and they get once a year. You can change using that. Don't be late. If you don't qualify for a premium free for Part A, you will have some penalties in here, 10% for Part B, 10%, and then the 1%, which is for the Part D. So let's try to get you away from having any type of penalties, okay?
Now, the interesting thing, though, is, so this is for people that are turning of age, but if you've been approved for disability, you don't need to apply for Medicare. It kind of just happens, and you get the letter in the mail that says you can choose your supplement, and you go through all the companies and their different benefit packages. But it just, it was crazy. They were like, you are now retroactive. And then they called me and they said, so all of the bills that were paid through Blue Cross, we're going to contact them and tell them, no, it needs to be reissued through the Blue Cross. You're choosing through Medicare. And I started to cry. I'm like, what do I have to do? Like, I have to call all the doctors. So like, no, we're going to do it all. Just go live and we'll take care of it. But just know the last 6 months, it's all going to get converted. And it was tough. I'll tell you one thing that was challenging is during the 6 months before I found out I was approved, I had been seeing a therapist who was a social worker. And what she told me is social workers they don't qualify for Medicare reimbursement. So all that 6 months she had to give back that she got paid from Blue Cross, because now it was retroactive through Medicare supplement Blue Cross, but LCSWs and LCSWCs, a licensed clinical social worker, which is different, they do get to, you can see them with Medicare. They can accept Medicare insurance. So it was a massive fight, but she did work it out. She won, because she said, how were we ever to know that this was going to be approved? So nobody should be penalized, because you can't see the future. But it is something to think about if you are waiting and pending in a decision and you're seeing a social worker. You might want to prepare and have that conversation up front. But and just rest assured that Medicare takes care of all of that behind the scenes. You don't have to do anything.
Yeah, and please don't ignore letters that they send. So, for example, one of my girlfriends, one of the agency partners, she had a legalese background because she was a lawyer in Venezuela. So I usually send her all of my clients that speak Spanish, but we had a veteran that she had a disability, but her disability had stopped. And she was in disability for about 10 years. So her
Wow.
Medicare stopped also. So she told my girlfriend, "Oh, bring me all your stuff in." Of course, her legalese, right? She started reading and says, "Well, here says that you have not provided this information. They have asking you here." And she goes, "Well, it's so much stuff. I just leave it there." So they actually went to Social Security together, and then she was able to provide the paperwork, and they approved they reinstated her Medicare. I mean, no, not her Medicare, but her disability. So now she's going to be getting Medicare pretty soon, and we're going to be able to help her with her options. So, yeah, here is some terminology. But I just want to thank you so much for the opportunity that you have given me tonight, and I'm open to questions.
Great. Well, I have two real quick before we check to see who might be with us online. I just want to, excuse me again, confirm that when you're on disability Medicare or Medicare due to disability under age 65, when you're turning 65, like I guess in 10 years, I'm going to start getting some paperwork as I get closer to age 65, right? Because it's then going to convert out of disability into an age 65 plan, correct? Okay.
Yes.
All right.
And what's going to happen is if for any reasons your disability, I can always just think you went to disability because you were needing a kidney transplant, for example, and now the kidney is working, everything is fine, and you're no longer in disability. So they are going to take your Medicare disability, but at age 65, you get now Medicare through aging into the system. But if you had a disability continuously and now you're turning 65, you are able to change in the middle of it because of your age of 65. It gives you an election period, and you can review. You should actually review your policy at that time because many things can change, and you might have access to additional services.
Okay. And then how is this like disability? It's dependent upon how many quarters you work. How long do you have to work and pay the FICA out of your paycheck before you're eligible to receive Medicare? What if you only worked 1 year of your whole life?
Right, and you can purchase then Part A of Medicare, but it's I think it's 4 quarters, and I think it's 10 quarters, 10 years per quarter or something like that. And now I know people don't work 40 years because but it's like it evens out. But I know it's 4 quarters. You have to work 4 quarters.
A minimum of at least at least a year, right?
Yeah.
Okay.
But let's see, for example, somebody that is coming, they have never contributed to the system, right? But they're now legal citizens, and they're over the age of 67, and they would like to buy into the system. They can actually purchase Medicare Part A and Part B. And it's actually sometimes even cheaper for them to do that than going into the Affordable Care Act or purchasing a regular plan.
All right, that's good to know. Okay, Josh, who do we have with us? Or is it a quiet night and everybody in Florida is preparing for a big hurricane?
Yes.
I hope that hurricane doesn't show up too badly.
Whew.
Well, we have that guy what is that guy in the Weather Channel that stands.
Yes, Jim Cantori. He's down.
Cantori. He's in Newport Richie, which is about in the other side of the town from us. We're in Separate Hills in the one side of Pasco, and Newport Richie is in the other side of Pasco. So he's been spotted over there. So
I know. Whenever Jim Cantori's around, something bad's going to happen. It's going to be very interesting. He doesn't want to go someplace where it's boring. That's for sure.
Well, the last few times that he's been in Tampa, he's been disappointed. Oops.
Oh. Well, I heard he was going down to like right around Fort Myers, Naples, that area. But they're getting a 5 foot, 3 to 5 foot surge, so that's probably not as exciting as some of the places closer to the Panhandle that are getting 9-foot
Yeah, yeah.
surges. So yeah, thoughts out to them.
Yeah, I'm gonna start this year so we can see each other. But
Yeah,
yeah, I mean, that's one of those things that we do call Tampa Bay is called the Bay of the Holy Spirit. So
yeah,
we have been blessed that even though some of them come straight for us, they do this little dance and then
right,
they go
right.
around.
Yep, very lucky. Lucky. They just need to bypass you. All right,
Yeah.
Josh, who do we have with us?
All right, let's say hi to Tom and Kathy and Christina and Natalie and Dean
Hi.
and Elena.
Oh,
And
That's
everybody
wonderful.
was saying hi, and I guess just absorbing everything. We didn't get any clicks for any questions or
Questions?
comments. Yeah,
Okay. Well, and that's, you
it's a
know what, that
lot to
could be a
take
good
in,
thing. It's
that's
a
for
lot of
sure.
information. But what I love is we will make sure that your information or a link to your website is on this, because as more and more people, so on the 30th, we have our live with a disability law firm. So this is kind of nice. It will tie in. And as more and more people become eligible, whether due to disability or due to aging in, I like that. I think I like that saying. It's
yeah.
at least something good that comes of aging, right? You're aging into something, kind of
Yes,
like what AARP, and you get your free travel bag or whatever. I don't know, whatever they're giving away these days.
yes.
When you age in, if you have questions, because it is a lot to take in, there's a lot of information. For a lot of us, processing information after open heart surgery can be really challenging, but at least they know now that they can give you a call. And if you're not, if these people are located in a state where you're not able to help them, you do have others that you can refer. Is there a fee to utilize people in your
So
industry, or is this a free
we
service?
get paid by the insurance company and we get
See,
paid the same amount of money. So our services are no cost to the client.
that's
Um,
great.
and like I said, at this point for us, it's really a calling. We love. I mean, sometimes people says, "What's your hours of work?" It's like, "Mm, I love what I
Whenever
do. I
someone
don't
needs
want
you.
to work."
Yeah, it's when people need you. It's
Yeah.
when people need you. So I love that. So if any of you have a question, there's no question, big or small, whatever you have and you need, you can always reach out and contact Rosie. And if she can't help you, she's got others that she can refer to you. And I know I'll be calling because I have, I mean, we just solidified. I changed my supplement, which I didn't think I could do, but I've had the same supplement for quite a few years. And now my biggest problem is I have to just tell every doctor I see, I have a new insurance. I'm just so not used to doing that because I can't remember who I told. Um, and I changed my prescription too. So that's getting used to that. And all of a sudden, like overnight, one of my drugs went down to 0. And I don't understand, what's this donut hole? It
Right.
doesn't sound something that's great, but I don't pay any money now when I'm in it. I feel I'm not paying anything.
And forget about the donut hole. It's not going to be any after this year. It disappeared. It's gone,
Okay.
and we don't have to worry about it anymore.
Okay, because I'm so confused. I don't understand it. I just know I would be paying a lot of money at the beginning of the year, which I expected for deductible. And then all of a sudden, like the last month. So here's an example. I was starting Rinvoq, which
Uh-huh.
is a drug for Crohn's and colitis and other things. And as I was talking to the specialty pharmacy, it was like 400 some dollars, and you get 4 pills. That's all you
Right.
take a month. And I'm like, you've got to be out of your mind. So of course the doctor's giving me samples. And so I did pay it for the first month. I think I got it down after talking to them like close to 3. I'm like, I got no choice, I have to take it. But then I went to get it when my new stuff kicked in, I think, and it was nothing. It
Right.
seemed like as soon as the announcement went out that Medicare would have reduction in costs for diabetes drugs, all of a sudden
Yes.
I didn't have to pay anything for this drug. And I just thought there's something very wrong here. But I zipped my lip and just took the bag and said, thank you. And I just left.
Yeah. And yeah, so insulin now is $35 if you ever have
That's
to pay
thank
insulin.
God, right?
Some plans, they're actually, if you buy the 3 month supply,
Hmm.
and I don't know how that, because it's insulin, you have to keep it refrigerated. Some plans might
Right.
have a co-payment of $12 per month. So
Yeah.
those are the things that be very honest. Tell us about all your prescriptions. I
Yeah.
remember when I used to go to people's homes, they used to carry this little roller. Like when I ask them, where are your medications? And they brought this little roller with all this stuff. And I will have to make sure that I review all the medications and things like that. But a thorough need analysis is one of those things that I tell people. My job is not to tell you this is the best plan or anything. My job is to listen and do a thorough need analysis so we can get what benefits that you have already paid for will work for what you need. Now, I'm not saying that we're going to be able to get you everything. However, we will explain what is the thing that you give up, because you can't have it all. If you get something, they will take something away from another place. But at the end, you will know, you know what? Maybe I don't really care too much about the vision because I have it from work, but I do care for my health, my membership, the gym membership, for example. So those are the and those are individual cases. That's why.
And that's the Advantage plan, correct?
Right.
That has the gym.
The Medicare supplemental. So again, it's not a one size fits all.
Right.
Whatever worked for your neighbor, for your wife, sometimes for your parents, is not going to work for you. Right. It might, but it might not. Most of the time, most of the times might not. And the other statistic I wanted to share, and I'll stop with this, but in our zip code in 33542, 1,000 people turn 65 per day.
What was that number again? Say that again.
1,000 people turn 65 a day.
Wow.
So in Florida alone, there's enough for everybody to help out. And you can do this as a part-time, keep your, because it is, if you are one of those people that want to help others, this is a really great profession to get involved.
Yeah, that sounds
more,
wonderful.
It's not the money, it's just really the help. How you see the people's going aha moments are priceless.
Oh, absolutely. I mean, before I knew about what you and your husband did, I know somebody else in the community, and honestly, someone in my husband's office does it, but I didn't even think to call her, whatever. But I went to this woman and she just wanted some information, and then she called me back. She goes, I sent you an email based upon all the medications you told me, based upon this and that. This is the plan I think is best for you. And I was like, you're already done? She goes, oh yeah, this is easy for me. But me going onto the website and plugging it in, I'm like, formularies and how many times a day and anything like that makes me so stressed out. So it's so much better when there's people like you, and this is what you love to do, and you can do it for me, and I don't have to worry about it. That's how I like life. Somebody else does it. And it doesn't cost me anything. It's great.
Medicare will never tell you about your doctors.
Right.
So that's why a local agent is very important, knowledge, because you will know what doctor takes what. Right. And that's the biggest thing, because people says, okay, I get all these savings. They go to their doctor, show their card. Oh, we don't take that plan.
Right.
And now they're freaking out. They're having, hyperventilating. And then I'm usually the one putting out fires.
Yeah.
Why did you do that?
Yeah, no, we had to do all that searching too, to make sure that all of my current physicians would take my supplement, which is Mutual of Omaha, which I've heard of, but I've never used them before. So here I went from Blue Cross to Transamerica to Mutual of Omaha, and I only put them in order because I've always been a Blue Cross person. It's just the most well-known. But I have no issues ever, 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 and I like it that way. If I have no issues and I'm not getting letters, I am completely satisfied client. I want ease of transaction. So you have made this very easy for us. Very easy for us tonight.
This slide did not touch is on veterans. And veterans. So they have, some of them have TRICARE, some that has the VA. Those are also people that we can help out, because they actually can have the best of both worlds. Continue to be with getting all their VA and TRICARE, and they also have their and they also can keep their VA.
Okay. All right. Wonderful. Thank you again so much. You made this so incredibly easy for us tonight. If we have questions, I'll be sure to get those to you. And again, we'll have SNR. I don't remember the rest of the name.
SNR Services.
SNR services, that's easy peasy. We will make sure that their contact information is up in case you have any questions and need them. And don't forget to click like, click subscribe, and share this information because I'm sure that somebody else will find this very educational. Thank you again so much, Rosie. I really appreciate your time.
Thank you. Have a good day. Bye.
All right, everybody. Take care. Bye-bye.
And you're out.